So we are very glad to have with us today Onno Schellekens. Onno is the Chief Executive of the Investment Fund for Health in Africa, which is a large investment fund that focuses on making for-profit investments to improve health outcomes in Africa. So Onno, welcome to the William Davidson Institute and the University of Michigan. We're very glad to have you here. I think our listeners and our broader group of stakeholders would benefit from knowing a little bit more about what the Investment Fund for Health in Africa does, and also why you chose to take a somewhat different philosophy for health improvement than what traditional donors, philanthropists, and even smaller investment funds do.
Okay. We're not a very big fund, actually. That's just as a start. I think we're around $75 million. But yes, to answer your question, in our philosophy, in states where there's not enough financial means to provide healthcare to everybody, the role of the private sector by default becomes much more important. And until now, I think also because of a development approach that has been viewing healthcare as a public good, and I think we all agree that health is a public good, provided that there is a public sector that can deliver it and that there is financial means to do so. And for this focus on the public side in Africa mainly, but also in Southeast Asia, there has been a neglectance of the importance of the supply side and the investment side. So one of the main things is that, just as an indication, in the period 1997-2007, so for a period of 10 years, the World Bank, out of 12.5 billion made available for healthcare worldwide, only made available $12 million for Africa. It's not that the World Bank is doing this wrong, but there is not enough attention for the importance of the supply side in order to generate the trust on the demand side, and it's an ecosystem. It should work on both sides. That's why we're focusing on this investment side.
Very good. And your focus is primarily on private sector investments, and you also, if I understand correctly, you also hope to get market or quasi-market returns from your investments.
Yes, that's true.
So is this a challenging endeavor, which means is it easy to think and find investment opportunities which will give you the kinds of returns that you and your investors expect? Or do you have to do a lot of hand-holding and then operating help for some of the investments that you make for them to get up to the mark where you can see this is a viable investment?
Well, I think any market that is undercapitalized has problems: shortage of capital, shortage of IT, shortage of human capacities, shortage of system standards, etc. And this is, of course, very true for countries that have been, endeavoring this for a long time. So it's not easy. I'm not saying that, you can just make an investment and then 5 years later you pick up the capital gains. Not at all. But I also think that because of the undercapitalization, there is, it's a market where the value, the price earnings that you pay are relatively low. So you can make good investments, I believe. And especially in the last 2 years, there has been a big psychological change, I think, because we're focusing on Africa in the general economic climate, and also on the healthcare sector in particular. There's much more attention for the role of the private sector. So, I'm fairly optimistic that we can make some real good investments. It would surprise me if that's not the case. Yeah.
Great. And many of the groups that we work with or are active in making investments in the private sector in health in Africa, one of the challenges they mention is the small deal sizes, which means you can find very small investment opportunities, but the transaction costs of doing a very small investment are high. You have to do your due diligence. You have to go out and and work with the entrepreneur, you have to understand the tax structure, you have to understand their accounts books, and just the sheer cost of doing that for a small investment don't always have the right cost-benefit balance. So what is your approach on this? Are you only making large investments? Are you making very small investments and reducing the transaction costs innovatively? What is your approach?
Yeah, that is it's a good observation for sure. I think there are three partial answers or perspectives that we try to follow. First one is that we focus very much on synergies through Pan-African propositions, so that you have the capacity and the critical mass to invest in a management structure. I think mobile telephony, MTN and Celtel are good examples there, although of course it's only possible when the market follows, but I think there are markets where this is possible. That's one thing. The second thing, and I think it's very important also to get more attention for, is that these health is an activity like education in the social infrastructure area, and we have spent for tens of years tens of billions, maybe even more, through public sector oriented models or through philanthropy based models, and importance of private capital has been neglected to a large extent, I think. So I think donors and also other philanthropists should pay more attention to technical assistance for these private investments, and you can structure that, I think, in decent ways. So that's the second thing to address that issue. And the third mechanism that I think also can be used is to really have public-private partnerships. So, you try to link public money and public objectives to private infrastructure, which reduces the risk, and therefore you can invest. It's not easy as well, but I think has a big potential.
Great. And insurance is one area where there has been a debate. Some people feel small community-based insurance in low-income countries is not feasible because the sizes of the pools are small, many other market deficiencies that exist. And if I understand correctly, your firm has made some insurance investments. So what is your viewpoint on the role of community-based insurance as a mechanism to improve healthcare in Africa?
Well, I think it's whether it works as a let's say an industrial solution for a whole continent. I'm not too sure. Because in the end you need the financial means to offer everybody a health insurance. But I think it's also, it's not for nothing that all OECD countries, all of them, including the Brits with their national services, that they had a period when there was not enough money. Even the US today is a good example, where they went through health insurance, because it pools the risk of the higher incomes, and therefore it creates an infrastructure that drives down the cost, so that in the end, when the redistribution mechanisms for income solidarity are in place and the state can impose means-tested systems, then you can offer nationwide coverage. Until that moment, whether you like it or not, and I'm a big believer of national services actually in OECD countries, but if that's not the case, you have to accept that you need two-tiered systems. And for that reason, insurance plays an important role in developing countries. But having said that, if you go out to the communities and the low-income schemes, yes, you need public money to do it, because who's going to pay? And once you do it, yes, you find the data, the actuarial data. When do people buy? What are they willing to pay? What are the consumption rates? How do you monitor and address issues of moral hazard, etc.? It teaches you a lot. Governments can then later on use it, but whether it's a holy grail, that's maybe a bridge too far.
Okay, very good. Would you be able to tell us about something that you consider as your showcase investment, so that people can see the tangible nature of what you do and how your fund operates? So some investments that you would call as, here's our success stories, here's our showcase.
Well, I don't want to say it's a showcase thing. I think Peters and Waterman with their book, what is it called, 20 years ago, Structures in 7 or whatever, they had all these examples. I think Michael Porter with Competitive Advantage is the same story. 5 years later, the companies were in big trouble. But for sure, I think from one of the biggest, our best example is, I would say, in the health insurance, indeed, in Nigeria. We were working with one of the largest HMO of Nigeria, and they were very undercapitalized for all kinds of reasons, but mainly because the development banks do not invest in insurance, and especially not in health insurance in Africa. So through grants of some big multinationals, we recapitalized the company, and at the same time a public contract, so with donor money, there was a health insurance pool set up for currently at that moment uninsured farmers. We spent $10 million through that system for those farmers being the chance to insure themselves. They started to prepay. We invested in the delivery mechanism, so the doctors and the clinics and the labs and the administrative side. And now 4 years later, prepayments are in, and 3 times as much has been invested in this ecosystem as what the development banks invested in 10 years' time in the whole continent. So it shows that if smart public policies, link with good private approaches, you can create quite a lot of improvements and reduction in cost and good returns as well.
Excellent. So tell us a little bit more about the structure of the investment fund. Is it a sovereign fund? Is it a set of multiple partners? Mm-hmm. Who all are involved in this fund, and how does the governance structure of the fund operate?
Well, it's a straightforward private equity fund. So it is a private equity fund. It is focusing on making returns. As shareholders, we have some development banks. So it's the IFC World Bank, the African Development Bank on one hand, the Dutch Development Bank FMO, and then we have Pfizer, Goldman Sachs, and a big Dutch pension fund called APG. And we have a bunch of multinationals who granted money and are a shareholder through a foundation. So through a not-for-profit structure, but they are a straightforward shareholder with their grant money. So Shell, Heineken, Unilever, and some Dutch banks and insurance companies. Yes, so they are limited partners. Then we have an investment committee, independent, and we just focus on investment cases, and we try to make good investments.
Very good. This is indeed very exciting, both the way it is structured and the kinds of investments you're making. So I know we can continue talking the whole afternoon.
Well,
I'm cognizant of time.
Thanks for the interest.
Thank you very much, Onno. It was great talking to you, and great to have you here at the University of Michigan.
Thank you very much for the interest in our project.